Next to the atlas, the second atypical cervical vertebra is the axis. Why the second cervical vertebra is called the axis? Because this is second cervical vertebra and this is odontate process or dens. This odontate process it acts as an axis for the rotation of the atlas and the head. This is atlas. So when the atlas and head rotates, this odontate process it acts as an axis. So it is called the axis or second cervical vertebra. Next question is, what is the most important characteristic feature of axis? Again, this odontate process or dens is the most characteristic feature, and its average length is about 15 millimeter in adult. But this dens it is not always in the midline. It may be tilted either anteriorly or posteriorly or laterally. Anterior posterior tilting extends up to 14 degree and the lateral tilting either right or left up to 10 degree. Then what are its parts? Parts are body and the vertebral arches, like that of the other vertebra. Which one is the body? This is the body. The body is a composite and consists of fused centrum of the atlas and the axis, and a rudimentary disc is present between them. This one is the odontate process. This is the conical and cranial projection from the superior surface of the body of the C2 vertebra. So this is the body of C2 vertebra. From its superior surface, this projection upwards is called the odontate process. Then what is attached to the tip of this odontate process? The ligament called apical ligament, it extends from the tip to the basic occiput. This is the occipital bone, this is the basic occiput. So the apical ligament extends up to this, and you should remember that this apical ligament is nothing but the remnant of the notochord. Another ligament attached to the dens is the alar ligament. The alar ligament it extends from each side of this odontate process to the margin of foramen magnum. This is foramen magnum of the occipital bone, and here is a projection of the odontate process. But in between this axis and the occipital bone is the atlas. So the atlas is like this. So the alar ligament extends from the lateral side, from each side of the odontate process up to the foramen magnum or up to the margin of the foramen magnum on both sides. What is the function of this alar ligament? The main function is to limit the rotation of the skull and the atlas upon the axis, and also they prevent undue lateral flexion of the head. Any other ligament attached to this odontate process? Yes, the inferior crus of the cruciate ligament attached to the posterior surface of the odontate process. Then the question may be asked, what is cruciate ligament? Cruciate means cross separate, like this. So if a cruciate ligament, there are 4 limbs, one upper, lower and 2 lateral. The transverse ligament of the atlas, this is the transverse ligament of atlas. You know what is transverse ligament of atlas. Here is the transverse ligament of atlas. And the other 2, one is above or upper crus and one is the lower crus. The upper crus called superior crus, this is called inferior crus. So the upper band or superior crus and lower band or inferior crus along with the transverse ligament of the atlas from the cruciate ligament. So what is the attachment of all these different parts? You know the attachment of the transverse ligament of atlas. The superior crus it is attached above to the superior surface of the basic occiput here, and the inferior crus it is attached below to the posterior surface of the body of the odontate process here. So this is the cruciate ligament. Next is, what are the joints formed by the odontate process? One joint between the anterior arch and the anterior surface of the ornamental process. This one, it is one median joint on or midline joint, and this joint, it is found between the oval articular facet on the posterior surface of the anterior arch and the anterior surface. Here is one facet on the dens, and this joint is a synovial joint and pivot type of uniaxial synovial joint. And what are the other joints? Come to the superior articular facet, these two, and these two are the inferior articular facet. The superior facet, it articulates with the inferior facet of the atlas, and the inferior facet, it articulates with the superior facet of the third cervical vertebra. So these two also synovial joints, and these dens also form synovial joint. So here two synovial joint called atlantoaxial joint, and here in between the third and second cervical vertebra, it is also another synovial joint. Then come to the transverse process. The transverse process, it is the smallest transverse process, very small, and its rounded tip, this one, it is homologous with the posterior tubercle of typical cervical vertebra. You know, this is typical cervical vertebra, and the posterior tubercle is this. This posterior tubercle is homologous with the tip of the transverse process of axis. Then this foramen is called the foramen transversarium, like that of other cervical vertebra, and the structures passing through this is the second part of vertebral artery, then vertebral vein and sympathetic nerves. Then come to the posterior side is the lamina. These two are lamina, and this is the spine. You see, this spine is very massive, this one, and also it is bifid, and it receives the attachment of the ligamentum nuchae. In the spine, here there are attachment of 5 pairs of muscles, so it is massive, and the muscles are rectus capitis posterior, major, obliquus capitis inferior, semispinalis cervicis, multifidus and rotators. Next come to the vertebral foramen here of the axis, and the structures passing through the mainly the spinal cord, and its covering and anterior and posterior spinal arteries along with the spinal axillary nerve. Then what are the vertebral notch? There are two vertebral notch, superior, inferior vertebral notch. Of these two notches, this superior vertebral notch, it is very shallow, but the inferior vertebral notch, it is deep. And you must remember that this median atlantoaxial joint and the lateral atlantoaxial joints are morphologically similar to the oncovertebral joints of lower cervical vertebra. And how the dens, it is kept in position. It may be tilted, but it is kept in position by some ligament. The most important ligament is the transverse ligament of atlas. So between the transverse ligament of atlas and the posterior surface of the body of the dens, there is a bursa in between these two. Which one is pivot? Pivot is this dens, and the ring is formed transverse ligament and the anterior arch. This form the ring, and this form the pivot. What are the components of kidney vertebral joints? The answer is, one is atlanto-occipital joint between the atlas and the occipital bone. Next one is the atlantoaxial joint, of which there are one median and two lateral, and the ligaments connecting the axis with the occipital bone. The median atlantoaxial joint, that means between the atlas and the dens, it does not take part in the transmission of the weight. The lateral masses of atlas and the superior articular facet of the axis are weight bearing. So weight transmits from the occipital bone or head to the lateral mass of the atlas, then through this to the axis here, then from the axis below it transmits to the bodies of the other cervical vertebra. This is the anatomical position.